Speed video made me get onto my preparation. There is an institute called Speed, and we are conducting a webinar. So that video made me get onto my preparation. That was my motivation to Speed videos. Speed conducted Zoom meetings in the evening. Attended that, and
So I bring in all the wishes and greetings on behalf of all the faculty members and team of Speed to Dr. Vivek Brundavanam for scoring a topmost rank of rank number 544 in MCA surgical group in NEET SS session 2025. Congratulations to you, Doctor.
thank you, sir. Thank you so much, sir.
And I also thank you for taking your time out in your busy schedule to share your valuable experiences with us and also to the students who are watching this video.
Thank you, sir. Thank you, sir. This
Okay.
is like a dream come true to give an interview with you, sir.
Thank you. Pleasure is mine. And
Thank you, sir.
can we know a brief background about yourself? I mean, where you started, what all you have done in your medical career till date, what all you have accomplished?
Yes, sir. I come from a city in Andhra Pradesh near Vijayawada called Machilipatnam, sir. I have done my MBBS from Manipal University, sir, in Karnataka, Manipal Medical College, Kasturba Medical College, Manipal. Then I've done my MS in General Surgery from NRI Medical College in Mangalgiri near Vijayawada, sir. Now I've given my NEET after passing my PG in MS General Surgery, and I've scored this rank of 544, sir.
Excellent, excellent. Amazing journey and wonderful journey, great accomplishment. And
Thank you, sir.
students and passion for the specialty could be seen. What is super specialty you're interested in?
I'm interested in MCH surgical gastroenterology, sir.
Very good, very good, excellent specialty. Now, who inspired you to do become one that way? I mean, to think about it and do that way.
My inspiration for taking up general surgery is my father, sir, who is also a general surgeon,
What is his name? Can we know his name?
Dr. Kesav Krishna, sir.
Excellent, excellent. Okay,
We
great.
have a hospital in Machilipatnam with my mother as the gynecologist there.
Excellent family of doctors.
Yes,
Great. Excellent.
with my grandfather as my inspiration for taking up medical field, sir.
Very good. Very nice to know. Very
He is happy to hear my rank also, sir.
wonderful, wonderful. Convey my regards to him as well.
Yes, thank you, sir.
Excellent. So once you decided to do a super specialty and SG as your choice, what did you do? How all you started your preparation? What are your preparation strategy? How much of time you spent for this? When you started this? Can you share something on that?
Yes, sir. I was sure of I'm sure I'll do a some kind of super specialty the moment I joined in MS itself, sir. I knew I did not want to stop with MS. I was not sure which one to do. I'm more of a private practice person more than a medical college or corporate hospital person. So I wanted to pursue something which will be more fit for private practice, sir. So I had options mostly of onco, uro, and gastro, sir. After my second year rotations, I have decided that gastro is the one for me, sir. My gastro surgeon Nitesh sir, who happens to have done his gastro and MS from Jipmer and Tirupati Medical College, Sri Venkateswara Medical College, has inspired me to pursue further in gastro also, sir. So from then I've decided that I wanted surgical gastro with urology as my backup option, sir.
Excellent, excellent.
Now I'm taking up gastro. My preparation wise, I have not prepared specifically for super specialty, but I have tried to be consistent in my studies from the first year itself. First year was mostly not enough for putting in time for studies. It was mostly hospital and ward works, sir. From second year, I have started studying, but not specifically for NEET. I have studied just from books like Bailey and my notes from my undergraduation, sir, from NEET PG preparation notes. I have used the same notes and same books for my PG exam as well, the exit exam for PG, theory exam. After my PG exam, before practicals, I had a gap of around 20 to 25 days, sir. In that gap, I have seen your videos, sir. You have conducted Zoom meetings in the evening, the right mindset for
Correct.
NEET super specialty. Someday I somehow happened to stumble upon your video and I've attended that. And I did not actually think I am going to prepare for the same year, which was in a gap of 1.5 months, because I had family commitments. I recently got married 2 months before my PG exam. So I thought I won't be able to do this year. I thought I'll prepare, but I somehow attended your video, and then I thought I might be able to do this time. Let me try.
Okay.
So after your video, I started slowly preparing during that gap between theory and practical exams. I cleared the practicals, and then I took a gap of around 1 week after practicals also. And then I got back to studying, sir. I gave a full-fledged preparation of around 20 to 21 days, sir.
Very nice. Very nice.
With short-term preparation, I'm very much happy with the rank I got, sir.
Great. Great. So, number of questions you answered in this exam?
I have attempted all 150 questions, sir. I
Very
have always been someone who advises the same, and even in your video, you were strongly advising to attempt all the questions, and which reinforced my idea, sir.
great. Wonderful. Now, about the paper, your opinion about your paper?
From the recalls that I have seen, this paper felt a little atypical from the previous years, sir. They followed the regular pattern of mostly general surgery, and next part being gastro, and along with CTVS being having a slightly higher weightage. But I felt the questions were slightly of a less conventional. I can't say higher standard or lower standard, but a less conventional pattern of questions.
Okay.
But I stuck to the 150 attempt rule, sir.
Excellent. Excellent. Doctor, who introduced speed to you? How you have been in sort of speed and
Uh,
what is experience?
I
Share for the
I
experience.
have I have not met anybody who has taken speed, but uh, somehow somebody texted me on WhatsApp and said there is an institute called Speed and we are conducting a webinar today. So I was like, let me give it a try and see how it is. So that video made me get on to my preparation, sir, and some question banks and videos, sir.
Excellent. Now, what is your advice for the future aspirants?
As everybody says, first attempt is the best attempt, sir. We should not rule out ourselves before trying seriously even once. My main motive for trying seriously was, even if not this time, at least for next time, I'll know what is to be read and what is to be left. I'll get a hang of the syllabus, content, sources, and what is to be done. That was my motivation to fully get on with the preparation, at least in the last 2 3 weeks.
Excellent.
I'd say don't rule out. Even 1 month is enough to get into very good ranks and even the most sort of branches.
Excellent. Excellent. Wonderful. Now, time to thank and whom all you want to thank. You feel that from
Uh,
date to date they have.
Definitely, I'll thank my family, sir, and my all my teachers, and above all, the superpower above us, which is not just above us, along with us also.
Great.
All my teachers and family, sir.
Great. Wonderful. We wish you once again all the very best on behalf of our entire Speed team. We wish you all the
Thank
best,
you.
all the success for a great
Thank
and
you so much.
career in surgical gastroenterology or super specialty. Best wishes to you.
Thank you, sir. Thank you so much.